Hi there, my name is Karissa Wang. I'm representing the David Geffen School of Medicine at UCLA, and I'd like to tell you about a project titled Perspectives on Enhancing Culturally Sensitive Care for Chinese Patients. It's well known that racial and ethnic disparities in healthcare exist in the United States. However, the current medical education system includes nearly no formal Chinese cultural training to help address these disparities. And while there is existing research detailing said disparities, there's been very little published around physician views on how to address them. So our goal was to elucidate physician recommendations in terms of providing culturally sensitive care to Chinese patients. And when we say Chinese patients, we mean both ethnically Chinese as well as other Chinese speaking patients. So we did this by interviewing 19 physicians in Southern California who each fulfilled at least one of the three criteria listed here. They each filled out a brief pre-interview survey, including basic demographic information, and then we conducted a virtual interview with them that was semi-structured in the sense that we went in with a list of questions we wanted to ask them, but as additional questions arose during the interview, we gave physicians the liberty to expand on those. And then we analyzed these responses to look for common themes and recommendations amongst all of the responses. So out of those 19 physicians, 8 were affiliated with academic centers and 11 were community physicians. And they ranged from general practice to all of these different specialties listed here. A large majority of them had more than 5 years of experience working with Chinese patients. And you can see here on the right, their responses to the statement, I feel that future health professionals should be taught more on various aspects of caring for ethnic Chinese patients. 12 of the 19 physicians, more than half of them, either somewhat agreed or strongly agreed with this statement. Then in terms of themes, there were 3 major themes identified. And the first of these themes was universal skills that physicians acknowledged were not necessarily specific to caring for Chinese patients, but that were very, very important in these cases. This included things like listening carefully to the patient, being open-minded and going into every interaction with no prior assumptions. They also mentioned observing body language. And specifically in the case of Chinese patients, they said that you might notice that a Chinese patient is less comfortable asking questions or speaking up. So it's especially important to observe body language to be able to tell when a patient might have something that, something on their mind that they aren't bringing up with you so that you can ask more and find out more about that to help address it. The second major theme was education. So this included language education, because physicians mentioned that a lot of times patients will go see a certain physician simply because they speak their native language, and that shared language kind of creates a basal level of trust before the patient even meets the physician. Very, very important in building rapport. It was also mentioned that it'd be helpful if students received some sort of training in traditional Chinese medicine so that patients would feel comfortable divulging the Chinese medicine practices that they're using to their physician and that their physician will be able to understand. And lastly, physicians really, really emphasized the importance of getting hands-on experience working with this population. The last theme is diversifying the workforce. Physicians really felt it was very important for trainees who are themselves from the Chinese or Chinese speaking community to return back to serving this population. They emphasized that not only will trainees feel a greater sense of satisfaction working with their own communities, but that their shared experiences, shared background create a sense of kinship that will do well for the patients, because these physicians really, really, really want to do right by these patients because they relate to them. These patients would feel more comfortable sharing information because they would feel closer to these physicians who came from communities very, very similar to their own. So here are some exemplar quotes. Feel free to pause the video to read them. And I'll just wrap up by summarizing that there were 3 main themes identified that physicians recommended to improve care for Chinese patients. These included employing universal techniques such as empathy and strong listening skills, educating future physicians on Chinese language, as well as basic understanding of traditional Chinese medicine, and lastly, encouraging Chinese trainees to return to their own communities as healthcare providers. Thank you, and feel free to reach out with any questions.